Coming to this lip, we commonly come across a congenital condition called as a cleft lip. I hope you might also have seen babies. What is a cleft lip? There is failure of fusion of the lips. So what happens is it can be either partial, or it can even extend to the palate. So either it can be partial or it can be complete. And then either it can be unilateral or it could be bilateral also. So you need to know what is the type of cleft lip repair that is being done. Is it partial or complete, or is it unilateral or bilateral? And thirdly, you need to know whether it is being done in a single stage or is it done in more than one stage, say like 2 or 3 stages. My question comes, why are they going to do it in so many stages? The simple reason is the subject is a small child. You can't subject the kid, the patient, especially babies and children, to such a long and general anesthesia for a surgical procedure for a longer time, because the brain is immature, right? So for that purpose, what they would do is they might harvest a graft in first place. Second time they might place it, or the procedure is going to be complicated, and that is where they want to do the operation in several stages. Based on the number of stages, whether it is single stage or whether it is in 2 stages, the code differs. Now my question is, for a patient, they have scheduled the procedure as 2 stages, okay? Now when you are going to report the second stage within the global period, what you'll have to think of? You will have to think of global modifiers, because now the procedure is already planned one. So when the physician is going to do the second stage of the cleft lip repair, you will have to report the code, CPT code, with a modifier 58 stating that it is a planned procedure. And next, what we need to know is whether is it as primary repair or is it a secondary repair. Imagine the patient has developed a scar contracture or dehiscence or some other complications, and the patient is coming back again for the treatment. In that case, you will have to use a secondary repair of cleft lip.